China is aging very, very fast than we expected 10 years ago. So now the question is, are we ready for such an aging society? And who will care for the elderly people? So I would like to discuss this with you with some of my opinions.
Who will care for China's seniors? To answer that question, we need to take a look at the trend of China's demographic change. According to the UN definition, if over 10% of total population in a country or region are older than 60s, or people aged 65 or above account for 7% of the total population, this country or region is categorized as an aging society. So where is China now? Let's see the chart on the left. In 2010, China has 178 million people over 60 years old, or around 12.5% of China's total population, which indicates the advent of an aging society. Many analyses demonstrate that by 2050, the percentage will reach 34.9%. Then let's look at the chart on the right. The demographic structure was a typical pyramid in 1950s. And then, because of one-child policy in 1970s, now we see the structure become a spindle in 2000. And maybe you know, we have started two-children policy since 2 years ago. The structure is still projected to become a cylinder in 2050. Or someone think it's like invert pyramid. No matter what you call it, in China, we are facing more and more serious aging problems. When there are more and more old people in China, the pension expenditure rises dramatically because working age population doesn't grow proportionally. The burden will become greater and greater. Here is a clear indicator of such burden: age dependency ratio. The ratio shows how many old people every 100 working age people must support. On this chart, the higher the blue column, the bigger the ratio, which means more old people to support by every 100 young people. By 2050, every 3.5 working age people have to support one senior person. The burden is huge and is increasing. In China, we've had a tradition for thousands of years that old people should be taken care by their families. And now we suddenly find that we do not have enough young people to take care of their old parents and grandparents. Therefore, only 67% of old people receive home care by family members or homemates. No matter how reluctant the other 33% old people are, they have to live in various care centers run by public and private institutions. As a matter of fact, those public and private institutions usually provide better quality of care than home care. However, many public institutions do have problems of insufficient beds and a very long waiting time, though the cost is relatively low. Private institutions, of course, charge more or much more and can provide much better services. There is an emerging kind of care provider who is mainly private and based in communities. This care model is predicated on small service centers operating within a community and in-home care given by these centers. The fact is that cost has been a very important factor old people consider when choosing care providers. In China, we have a very strong state-run social insurance system. Since China doesn't have a very robust long-term care insurance system, the answer is pension fund managed by the government. This chart shows pension fund balance and number of months fund can last in different regions in 2016. If we put all funds in different regions together, we can see the total sum can only pay 17.2 months of the pension in the entire country. Some areas actually are already faced with deficit in their pension funds. For example, let's see the Heilongjiang province, the northeast province in China, have $3.6 billion in deficit. With a large retired population in China, the average level of pension received by old people is relatively low, at least not enough to support good quality of senior care. So I think we need to find solutions. We have seen the challenges in care provisions and funding for elderly care services. Can the current elderly care model hang on? To answer this question, we need to focus on addressing two most fundamental issues, that is, who will pay and who will serve. Well, it is always wise to borrow a lesson from the best practice in developed countries. Well, firstly, the economic powerhouse of Europe, Germany. In this country, you see there are enormous amounts of senior care service providers, both privately run or philanthropic, to take care of old people. In terms of funding, Germany has a universal compulsory long-term care insurance, constituting the fifth largest component of its social security system. The law stipulates that 1.95% of an employee's wage enters the fund. The employer and the employee shall each bear half. Retiree pay half of the premium, while the other half will be paid by the pension fund. Let's shift our attention to Asia, Japan. You know, Japan has entered an aging society earlier than China. So the country has more established senior care models and infrastructures. Elderly care services are mainly provided by the local public organizations, social welfare organizations, medical institutions, private companies, and non-profit organizations. Japan has a multi-layered service system, as it is shown in this figure. Different levels of care are provided to old people with varied dependency status at the discretion of local review of committees. Well, actually, you see, Japan has more. They now use robots to provide assisted mobility. In the future, we can count on artificial intelligence to bring more solutions. In terms of funding, Japan also has a state-led compulsory social insurance system, in which users aged 40 or above shall bear 10% funding, and the government and insurance premium each contributes half of the rest. Talking about elderly care in the US, I'm sure every one of you sitting here must know much better than I do. It's really a pity that I am not able to be present today at the conference to learn more from you personally. But in case you miss something about your own system, I prepared this for your kind reference. This bubble graph shows how different types of senior care overlap and the relationship between the different levels of care and the cost. Senior care providers in the US are very diverse. Funding is more market-oriented and mainly comes from the commercial insurance companies. Considering the best practices in developed countries and the realities on the ground in China, I think social security system alone cannot provide enough fund for high-quality senior care in this country. I think it's also impossible for public institutions to provide the sound senior care services. So therefore, I think we need a new model, that is, a financial and business model independent from the government fund and public institutions. Where the government fund and public institutions provide minimum and basic senior care services, the majority of old people may enjoy high quality of care services from the different private providers by taking advantage of different financial models. We suggest the state-run senior care institutions, of course, have the obligation to provide minimum and basic senior care services to people who have very limited financial resources. But it is not very cost-effective for government to be an owner or an operator of senior care institutions. The government should become a service buyer who also makes favorable policies to make sure old people are properly taken care of. As the major service providers, private in-home care institutions, community care centers, nursing homes are obliged to provide different levels of care services to meet various demands. Service providers can receive funds from private capitals, personnel from training institutions, and payment from commercial insurance companies. For most people, a more reasonable solution is to buy long-term care insurance when they are young. Without a long-term care insurance, personal savings goes like a dotted line. If a person buys long-term care insurance, its premium is the blue line. After 60 years old, the person starts to claim services allowance. His saving will not be affected very much. His actual saving goes like the green line. With long-term care insurance, old people will have good financial condition and enjoy better care. Unlike social insurance, long-term care insurance premiums are the most important funding sources for private service providers. Besides the above two models, there is a third option for people, either with limited financial resources or without long-term care insurance. As you know, we Chinese people have another tradition. We like to buy houses. Almost every old person has his or her property. So, reverse mortgage is the third option. If an old person has limited financial resources and no long-term care insurance, but need decent care services. The reverse mortgage products is something he may take advantage of. While he can receive monthly allowance from financial institutions to cover better care services, he could still live in his own property. The financial institutions which operate reverse mortgage may issue asset-backed securities to ensure their cash flow. One of the major risks of this product is that no one can guarantee the real estate price will never drop. So the evaluation of property is the most critical and technical job. Actually, securitization of fixed assets may somehow hedge the risk of price fluctuation. Of course, another risk is we don't know how long that old man will live. My understanding is that it will be wonderful if any of the old persons who take advantage of reverse mortgage live forever, because that will really create the most effective advertisement in this market. I'm sure every financial institution will love it. With sound business and financial models, technology can catalyze the change in senior care. We can provide senior citizens who purchase community-based care services with Internet of Things and wearable devices. These devices can monitor and record vitals, provide intelligent health coaching, and provide early health warnings, and sound the alarm when emergencies occur. We can also use intelligent surveillance cameras to help family members monitor in-home care services in real time. This approach can ensure the quality and transparency of care services. Big data can help trainees to receive professional training remotely, adding to their professional skills and increasing the supply of professional caregivers. All these tech can drive the change in elderly care model and improve the quality of services. Okay, the market is really huge. The number of Chinese people needing long-term care is trending up year on year. So is the spending. By 2020, according to optimistic estimation, the total spending on long-term care will reach $47.3 billion. And by 2050, the number will be $208.8 billion. So the future is very promising. An aging society can be a big challenge, but if dealt with properly, it represents the single biggest opportunity in China, big enough to deserve the attention of companies, academia, and public institutions worldwide. I'm looking forward to collaborating with you to take up the opportunity and face down the challenge.